Hey everyone, so in this video I will be explaining you my community post that I have sent yesterday. So it is about urea cycle disorders. So let's understand what is the diagnosis from infant number 1 to infant number 5. All those who have responded to the question, so thank you for that. I have responded to your the answer that you have explained. I replied to that. So let me begin explaining what is actually the what are the answers for all that particular question there. Now infant number 1 to infant number 5, so you'll have to look at the columns here. So in the very first columns which I have written here, so this is infant number 1 to infant number 5. Second column you have urine orotic acid, orotic acid which is made in the cytoplasm coming from carbamyl phosphate is the one that goes into orotic acid in the cytoplasm. Blood citrulline is there in the third column, blood arginine level in the fourth column, and blood ammonia level in the fifth column there. So the first infant, as you can see, so I'm not sure if it is very clear to you in this particular video, but let me read it for you. So the infant number 1 has low orotic acid, low citrulline, low blood arginine levels, but high ammonia level. So there is a hyperammonemia in this particular child, and there is no citrulline, no arginine, no orotic acid. That means it is number 1 enzyme in urea cycle. Urea cycle enzyme has got basically urea cycle has got 5 enzymes. So out of these 5 enzymes, so the very first enzyme is carbamyl phosphate synthetase 1 enzyme. Second enzyme is ornithine transcarbamylase enzyme. Third enzyme is arginine synthetase enzyme. Fourth enzyme is arginine enzyme. Fifth enzyme is arginase enzyme. Okay, so these are the enzymes in urea cycle. So where if there is a very first enzyme, if it is defective, there will be hyperammonemia in those patients, and there will be increase in glutamine level. So what is given in this particular slide here is ammonia level is high, but other things are low. Like you don't see like orotic acid, you don't see citrulline, you don't see arginine. So it is probably the first enzyme which is defective here. Coming to the second infant, in second infant orotic acid levels not mentioned, means normal. Citrulline level is too high, more than 1000 micromoles is the citrulline level, too high. Blood arginine is low, ammonia level is high. So there is hyperammonemia, but importantly there is increase in citrulline. So when there is a buildup of citrulline, so the enzyme before citrulline formation, and that is the enzyme that is after citrulline formation, where the citrulline is condensing with aspartate. So the citrulline which condenses with aspartate, so that is done by arginine synthetase enzyme deficiency. So the citrullinemia is because of deficiency of arginine synthetase enzyme. That's why the second infant, since citrulline level is high, arginine level is low, blood ammonia level is high, so that means it is a arginine synthetase enzyme deficiency. Now let's move on to see the third infant. Third infant, orotic acid not given, so consider normal, but blood citrulline levels normal, blood arginine level is too high there, and blood ammonia level is moderately high. So what happens? So when there is a high arginine level, that means arginine is not converted to urea by arginase enzyme. So it is a hyperargininemia condition because of deficiency of arginase enzyme. That's for third infant. So now let's move on to see the fourth infant. Fourth infant has a high orotic acid level. As you can see, fourth infant has high orotic acid level, and then there is a low blood citrulline level, low arginine level, and high ammonia level. That means orotic acid is high but citrulline is low. So this is somewhere like after the formation of carbamyl phosphate but before citrulline formation. So that means when there is a high orotic acid, so and citrulline level is low, that means ornithine transcarbamylase enzyme, which is a X-linked deficiency of this enzyme is an X-linked recessive condition. Ornithine transcarbamylase is the most common urea cycle disorder, and in this particular disease carbamyl phosphate which is elevated will go out of mitochondria into the cytoplasm, and in the cytoplasm this carbamyl phosphate, it will be going into pyrimidine biosynthesis, and in the pyrimidine biosynthesis carbamyl phosphate, it will be converted to converted to orotic acid, one of the intermediate in pyrimidine biosynthesis. So carbamyl phosphate, which is forming condensing with aspartate to make carbamyl aspartate to dihydroorotate, orotate, and then the orotate monophosphate, uridine monophosphate, like that pyrimidine synthesis will go on. So the excess elevation of carbamyl orotic acid is an indication that there is a deficiency of ornithine transcarbamylase deficiency, because Cp, that is carbamyl phosphate, which is elevated, goes out of mitochondria into the cytoplasm, and in the cytoplasm it will go into pyrimidine biosynthesis, leading to elevation of orotic acid. So presence of orotic acid, excess levels of orotic acid and decrease in citrulline and elevated ammonia level is actually the case of ornithine transcarbamylase deficiency. Coming to the fifth infant, in the fifth infant there is a high citrulline level, not really too high, like it is 200 micromoles. Citrulline level is high, but arginine level low and blood ammonia level is high. That means there is hyperammonemia, but it's like citrulline level is moderately high here. That means citrulline conversion into further, like arginine level is low. So this is where argininosuccinate comes in. Like citrulline is converted to argininosuccinate has to be converted, breaks into arginine and fumarate. So if that reaction, basically if it is affected, so if there is a deficiency of argininosuccinate lyase enzyme, which is breaking argininosuccinate into fumarate and arginine. So if there is a deficiency of argininosuccinate lyase enzyme, which will lead to elevation of argininosuccinic acid, which is not really mentioned here. Argininosuccinic acid is not mentioned, but citrulline level mentioned, which is little bit higher, and arginine level is lower. So in that sense, I would say, so it is a case of argininosuccinate lyase enzyme deficiency, leading to excess argininosuccinate levels. So these are all the diagnosis for all these 5 infants in this particular question. So the first infant has got carbamyl phosphate synthetase 2 enzyme deficiency, and the second question, it is a citrullinemia case, that means there is argininosuccinate synthetase enzyme deficiency, and the third case is where high arginine level is present, it is hyperargininemia arginase enzyme deficiency, and the fourth case is orotic acid is high, so that is ornithine transcarbamylase deficiency, and the fifth case is citrulline level is moderately high, arginine level is low, argininosuccinic acid is not mentioned. In that sense, this is argininosuccinate lyase enzyme deficiency. If they would have mentioned argininosuccinate being elevated, that would have been an easier question, easier case to diagnose, right? So in the absence of that, you will have to interpret it differently, so that will go into argininosuccinate lyase enzyme deficiency. So that's about the answer to this question. I hope this video has helped you in understanding urea cycle disorders. I have a video on urea cycle disorder, link for that video is there in the description below, and also I have a video on urea cycle regulation, link for that is there in the description below. So if you like the videos, give thumbs up, give some comments there, appreciation or something. If you have any question, don't hesitate to put that in the comment section below. So when I get time, I am going to answer that question to you. Okay, so if you like the video and you feel like sharing with your friends so that they also get benefited from this particular video, thank you and see you in my next video.